viruses. The one thing that it talks about a lot is antiretrovirals for HIV. Now, chances are you may have patients with HIV. Typically, they're going to be monitored in a specialty situation, usually at the med center. It doesn't mean I don't want you to know about these medications, but I'm going to tell you, and all the time I've been practicing, I've never actually made the diagnosis of HIV, nor have I initiated the treatment for it. And you may, but for the purposes of passing your board's examination, it's not the bulk of the information that you're going to need to know from this chapter, okay? So, common viruses, of course, the common cold, don't treat it. Treat the symptoms. It has no antiviral to go with it. Now, influenza. So we have no treatment for that, but except for symptom management. But always encourage your patients to get the flu vaccination. Reasons that they might not be eligible for the flu vaccination: number one, egg allergy, because we grow the vaccine in eggs. Number two, history of Guillain-Barré syndrome, an ascending paralysis, and the other is, of course, hypersensitivity to the flu. Now, people who take the flu vaccine and get sick and say they have the flu, that's not necessarily hypersensitivity. It's kind of like patients who tell me they're allergic to Benadryl because when they take it, it makes them sleepy. I'm like, oh my God, that's horrible. So influenza. When it does come to human immunodeficiency virus, the class of medications for treatment are called HAART, H-A-A-R-T, highly active antiretroviral therapy. Just know that acronym. And on page 341, over in the right, under the first paragraph on the right column, it does talk about the 6 different types of the HAART medications. Like I say, know them for your own purposes for board's examination. If they would appear for this quiz, I don't intend to ask you much more than what is the category of medications used, which would be the HAART. Now, and that goes on all the way to 345, so skip over to 345, antivirals for herpes infections. So, page 346, table 18.1. There are a million types of herpes virus. It's something that has evolved as much as a papillomavirus. We seem to think that it's something that's brand new, but it's been around for millions of years. Most reports indicate that the large majority of people carry some form of herpes virus or papillomavirus. It's just that most people are never symptomatic, so don't get scared to go running out this and that. I'm just saying, be aware of it because you may see it in your clinic. There are many, many, many lesions that I see on these patients, and it's an incidental thing. Hey, what's this? Or what's in my nose? Or this, that, and, well, there's a good chance it's a herpes lesion. And you may be surprised that they've been taking this and that, and it's just not getting better, and then you put them on the acyclovir, and oh, it gets better. And I tell my patients, it's nothing to be ashamed of. It's not like you've got the scarlet letter or anything like that. So here's easy: herpes simplex 1 is above the waist, oral, ocular. 2 is below the waist, genital herpes, things like that. Then, of course, you've got chickenpox, the varicella zoster. You've got herpes zoster, shingles. I see that a whole lot, and you will too. So, things that I'm going to ask you about when it comes to herpes in general, we're talking about an antiviral called acyclovir. Now, it's got a couple of different subcategories, valacyclovir. Those are things that you're going to use to treat herpes outbreaks, whether it's simplex 1, simplex 2, zoster. if you have an adult who's never had chicken pox and they do have chicken pox, and I've seen it, people in their 40s and 50s having chicken pox for the first time, treat them with acyclovir. Okay, um, so um, oh, don't forget about the Epstein-Barr virus and mononucleosis. Okay, I think about mono and shingles, and most I see that more than anything. Shingles predominantly. So I'm not going to ask you about the shingles vaccine. That's on your vaccination section. But remember, when treating shingles, and this is fair game for the test, we're going to treat them with acyclovir if, and this is something very, very important to watch for. I see it all the time. When patients are complaining of headaches and they've got beautiful hair like I don't, look through their hair, especially when the pain medications have stopped working and it's just not getting better, because I cannot tell you how many times in the ER they couldn't find the source of the headache, and when I get a comb, go, oh my gosh, there are the herpes lesions, and they make their way down and along these neural pathways, and a lot of times they'll come onto the face, or they may ascend up the neck. If you get zoster lesions around the eyes, be very careful. You can get an ocular herpes, which is threatening to vision. So if you're even close to suspicious and the patient does not require hospitalization, always get them in to see an ophthalmologist very soon. Now, we're talking about acyclovir that you're giving orally for the treatment of herpes zoster. If you are suspicious of herpes in the eye, start ganciclovir ophthalmic solution. Okay. Um, so herpes zoster, acyclovir. And the other thing about it, and the reason I'm talking about herpes zoster is because you're going to see it a lot, and they're always old people, and it really hurts, and you really feel bad for them. It's not like you're 34-year-old with end-stage fibromyalgia who only can have Dilaudid. Sorry if anybody's got fibromyalgia or family who does. I believe it's a real disease, but you know exactly what I'm talking about. So people who are having shingles, whether it's on their face, whether it's on their neck, back, chest, whatever, always start them on gabapentin, something to help with the neuropathic pain. And don't wait for the lesions to crust over to start them on that. You'll never get ahead of the pain if you wait for it to truly stop. That's why it's called the post-herpetic neuralgia. It's after the lesions have erupted. That pain, there's two kinds of pain: the original pain, and then once those suckers start to crust over, then the real irritation sets in. So always start gabapentin with acyclovir. Now, I've spent just a couple of minutes talking about that on a whole section of viruses. Sounds like quiz material to me. So read up on that on page 346. It goes on a little bit over on 347. It talks about all the different types of cyclovirs. I only care about probably at the very there's a table over here, acyclovir at the top, and then we talked about ganciclovir. That's probably not going to be on your exam. And then valacyclovir, Valtrex. That's a pretty common and popular prescription, and a lot of times it can be taken only in 1 or 2 days for a flare-up. So when compliance is an issue, we're talking about young people or anybody really, valacyclovir can be a good choice because it's easy to take. Okay. We already talked about the influenza on 349. As far as that goes, I will ask you more often which of these patients should not get the influenza vaccination. Bottom line is most people should. Now, I will tell you from personal experience, I've gotten, well, before I ever got the flu vaccine, I never had the flu. After I started getting the flu vaccination, when I first started nursing schools, we had to have it. I never got the flu. This past year, I got the flu vaccination, and I got the flu. It's going to happen. That does not mean I'm not getting a flu vaccine this year because it sucked. It was horrible. And then it turned into pneumonia, which is even worse. And I've got a whole new respect for people with pneumonia. It's not, I didn't respect it enough. Anyways, so flu, antifungals. The whole thing about amphotericin B, that's really